welcome to another episode of Smart Sex, Smart Love. I'm Dr. Joe Court, and today I'm going to be focusing on a series I'm about to do about why straight men have sex with men. They're not gay, they're not bisexual. They're straight men who have sex with men. And the very first thing I'm going to talk about that I spent actually two chapters, the very first two chapters on in my book, Is My Husband Gay, Straight or Bi? A Guide for Women Concerned About Their Men, is about sexual abuse. That the most common thing that I see in my therapy office are men, straight men, who've been sexually abused by male perpetrators in childhood, reenacting that trauma into adulthood. I'm going to give you some examples, and there are composites of clients I've had over the last 32 years. They're not one person, but I think they help illustrate what I'm trying to say. I had a client come to me once because his wife had caught him engaging in sex acts through the internet on performing oral sex on men, wanting to do it, talking about doing it, actually having met other men to do it. And she, of course, thought he was gay. Of course, he wasn't sure whether he was gay or bisexual. And so they came into my office very upset, very troubled. So when I did a history on this guy, which we do as therapists, I feel like the first few sessions have to be assessment, obviously, and history taking. I found for this particular guy that he had a history where he was a young boy and he had an older cousin and brother that were engaging in an activity that he wanted to be a part of. He was younger, he looked up to them, and he said, "May I join you?" And they said, "Sure, you can join us if you give us blowjobs." And he said, "I'm not going to do that. I don't want to do that." And they said, "Well, then you can't join us." So that was the end of that. And he thought about it for a little bit and decided that he wanted to join them. So he said, "I'm willing to do it," knowing that that would get him in, that his goal was to get in with them. So they pulled out their penises. He went to perform oral sex on them, but before that was able to happen, they pushed him to the ground. They called him a faggot, and they said, "See, we always knew you were a faggot." And they laughed at him and didn't allow him into their activity. Well, this client didn't talk about that forever. By the time I see him, he's in his 30s, his 40s, and he's never told his soul. And it's a shame imprint. That's a trauma that happened to him. Was I gay? Why did they do this to me? Should I tell somebody? Are they going to think I'm gay? There's all these things that go on in a boy's mind. So they don't tell. And this particular client didn't tell. But it doesn't go away. The brain remembers. The mind remembers. And so then it goes back to the scene of the crime. The sexual scene of the crime is really what I call it. And so now he's reenacting that over and over again. And in my office, he's telling me, "I'm really not into this. It's not really what I want to be doing, but I'm doing it because I feel compelled to do it. It feels like a compulsion. I feel like a sex addict," he'll say. And what we'll find out, it's not about sex addiction, and it is a compulsion, but it's because he was sexually abused as a child. That was a shame imprint, a trauma imprint. So now we do the work. We do group therapy, individual therapy. I'll do alternative therapies called EMDR, eye movement desensitization reprocessing. There's lots of trauma work that I'm trained in that I do with my clients. And eventually, the goal is to help him be in control of the behavior rather than the behavior being in control of him. And I was able to help him recognize he was a heterosexual man who was sexually abused and engaging in homosexual behavior. Homosexual behavior isn't homosexual identity. It's not a gay identity. It's a gay behavior. And so here's what's the important piece about this. He didn't stop fantasizing about giving oral sex to men. Now that had become part of his erotic identity. That didn't make him gay. That didn't make him bi. It made him a straight man whose erotic identity included giving oral sex to other men because he'd been sexually abused. A lot of well-intended but misinformed therapists think that this means he's still reenacting his trauma, even if he's thinking about wanting to do this. And I'm going to tell you right now, that's not the case. When we are early imprinted, those things can become eroticized and they don't go away. They might go away, but the goal isn't to necessarily get them to go away. It's to get the mastery of the behavior so that you're not acting out anymore against your own will. So that's part one of my series. I'll be back next time to talk about other reasons why straight men have sex with men during the Smart Sex, Smart Love series. And thanks for listening to me, and I'll see you next time.